The sound of tiny sneakers hitting wet pavement echoed through the night as 7-year-old Emma Martinez stumbled toward the emergency room doors. Her father, Carlos, carried their sleeping infant son in one arm while frantically searching his empty wallet with the other. The fluorescent hospital lights cast harsh shadows across Emma's pale face as her small body suddenly crumpled to the cold concrete, her fevered whispers barely audible above the distant wail of sirens. Carlos dropped to his knees beside his daughter, his heart shattering as he watched her chest rise and fall in labored breaths. 3 days of fever, 3 days of watching his little girl fade away while he counted pennies and called every clinic in the city, begging for help they couldn't afford. Now, as Emma's eyes fluttered closed on the hospital doorstep, Carlos felt the crushing weight of a father's worst nightmare, knowing your child needs help and being powerless to provide it. The automatic doors whooshed open, and Carlos gathered Emma in his arms, his voice breaking as he called out desperately to anyone who would listen. "Please, someone help my daughter." Dr. Sarah Chen was just finishing her 16-hour shift when she heard the commotion. She'd been looking forward to going home, to a hot shower and her own bed, but something in that father's voice stopped her cold. She rushed toward the sound, her tired eyes immediately focusing on the limp child in the man's arms. "Bring her here, now," Dr. Chen commanded, her exhaustion evaporating as her medical instincts took over. She guided Carlos to an examination room, quickly assessing Emma's condition while firing off questions. Temperature, duration of symptoms, any known allergies are the clinical questions that could save a life. But it was the other questions, are the ones about insurance cards and co-payments, that made Carlos's shoulders sag with defeat. He explained through tears about losing his job at the construction site, about choosing between rent and groceries, about watching his savings disappear during his wife's battle with cancer the year before. Emma needed tests, possibly surgery, and treatments that would cost more than he made in 6 months. Dr. Chen had seen this scenario countless times before. Good families destroyed by medical debt, children suffering because their parents couldn't navigate the maze of healthcare bureaucracy. She'd become a doctor to heal people, not to watch them deteriorate because of financial barriers. "We'll figure out the payment later," she told Carlos firmly, though she knew the hospital administration wouldn't appreciate her cavalier attitude toward billing. "Right now, your daughter needs immediate attention." As Emma was admitted and began receiving treatment, Carlos found himself in the waiting room at 3 a.m., holding his sleeping baby and staring at discharge papers he couldn't afford to pay. The estimated cost made his stomach churn. It represented more money than his family had seen in years. What Carlos didn't know was that his story had already begun rippling through the hospital corridors. Dr. Chen had quietly mentioned Emma's case to a few colleagues during shift change. Nurse Patricia Williams, who had 4 kids of her own, overheard and felt her heart clench. She'd been in similar situations, choosing between her children's needs and household expenses. Patricia mentioned it to her friend Miguel, a janitor who worked nights to support his elderly mother and put himself through community college. Miguel, despite making minimum wage, had been putting aside $5 from each paycheck into what he called his emergency kindness fund, money he'd saved for moments exactly like this. The ripple effect continued. The security guard, James, whose own daughter had overcome childhood leukemia, quietly approached the billing department. The cafeteria worker, Mrs. Rodriguez, who had watched her grandson struggle with asthma, started making phone calls to her church group. Even Dr. Peterson, the chief of pediatrics, who was known for his stern demeanor, found himself thinking about his own children sleeping safely at home. By morning, something extraordinary had happened. The hospital billing department received an unusual flood of small payments toward Emma Martinez's account. $5 from Miguel, 20 from Patricia, 50 from Dr. Chen, 15 from James, and dozens of other small contributions from staff members who had heard Emma's story and couldn't ignore it. But the most surprising contribution came from an unexpected source. Mrs. Eleanor Hartwell, an elderly woman who cleaned offices in the hospital's administrative building, had been silently listening to the conversations around her all night. She was 73 years old, lived alone in a studio apartment, and survived on Social Security checks that barely covered her rent and medications. Eleanor had spent her entire life cleaning up after other people, literally and figuratively. She'd raised 3 children as a single mother, working multiple jobs to keep food on the table. She understood what it meant to love your children so fiercely that their pain becomes your pain. Their needs supersede your own. What no one at the hospital knew was that Eleanor had been quietly saving money for nearly a decade. Every week, she put aside whatever coins she found while emptying trash bins. Every dollar bill she discovered in forgotten pockets while sorting laundry. She called it her angel fund, though she'd never told anyone about it. The total had grown to nearly $3,000 over the years, a small fortune for someone living on her meager income. Eleanor had always wondered what purpose that money would serve. She had no grandchildren nearby, no causes she particularly championed. But standing outside Emma's room that morning, watching Carlos sleep slumped in an uncomfortable chair with his baby against his chest, she finally understood why she'd been saving. She walked to the billing office and quietly paid the remainder of Emma's hospital bill in full. When Carlos woke up later that morning, a hospital social worker sat beside him with a smile that seemed too bright for the sterile environment. "Mr. Martinez, there's been an unusual development with your daughter's account." Carlos braced himself for more bad news, assuming they were going to demand immediate payment or transfer Emma to a public facility. Instead, the social worker handed him a receipt showing a zero balance. "I don't understand," Carlos whispered, staring at the paper as if it might disappear. "Sometimes," the social worker said softly, "people surprise you. Your daughter's bill has been paid by anonymous donors, hospital staff and others who heard about your situation. The entire amount." The revelation hit Carlos like a physical blow. He doubled over, overwhelmed by a mixture of relief and disbelief. Strangers had taken care of his family when he couldn't. People he'd never met had seen his desperation and responded with unprecedented kindness. Dr. Chen appeared in the doorway, her shift officially over but her concern for Emma keeping her at the hospital. "Your daughter is going to be fine," she announced with a tired smile. "The antibiotics are working, her fever broke an hour ago, and she should be able to go home this afternoon." As if summoned by good news, Emma's eyes fluttered open. "Daddy?" she whispered, her voice still weak but notably clearer than it had been in days. Carlos rushed to her bedside, taking her small hand in his. "I'm here, Mija. Everything's going to be okay." "Are we going home now?" Emma asked, her fever-bright eyes focusing on her father's face. "Yes, baby girl, we're going home." What Carlos never learned was the identity of his family's guardian angel. Eleanor Hartwell finished her shift that morning, took the bus home to her small apartment, and made herself a cup of coffee. She sat by her window, watching the sunrise paint the city in golden hues, and felt a satisfaction she'd never experienced before. Her angel fund was empty, but her heart felt fuller than it had in years. Somewhere across town, a little girl was going home healthy, a father was learning to believe in human kindness again, and a baby would grow up in a family that had been reminded of humanity's capacity for love. Eleanor never sought recognition or thanks. She never told anyone about her contribution. But for the rest of her life, whenever she passed the pediatric wing during her cleaning rounds, she would think of Emma and smile, knowing that sometimes the smallest acts of love create the most profound changes. The ripples of that single night continued long after Emma's recovery. Dr. Chen established a small fund for families facing similar crises. Patricia organized regular staff collections for patients in need. Miguel's emergency kindness fund grew as other employees began contributing. The hospital itself, inspired by the grassroots generosity of its staff, created new policies to help uninsured families navigate treatment options. And Carlos Martinez, forever changed by the experience of witnessing such unexpected compassion, began volunteering at a local community center, helping other families understand their healthcare options and navigate social services. He wanted to pay forward the miracle his family had received, to be for someone else what all those anonymous donors had been for Emma. Sometimes the most powerful transformations begin with the smallest gestures of love. A janitor's $5 contribution, a nurse's $20 gift, an elderly cleaning lady's decade of saved coins are individually modest acts that, when combined with dozens of others, created something magnificent. They proved that when ordinary people choose compassion over indifference, miracles become possible. Emma Martinez grew up knowing that a community of strangers had saved her life, not through grand gestures or wealthy donations, but through the collective kindness of working people who recognized her father's love and chose to help. She learned early that heroism doesn't require capes or superpowers. Sometimes it just requires seeing someone else's pain and deciding you can't walk away.